Hello everyone, my name is Nicole Tapio, and today I will be talking about estrogen. Pictured here is estradiol, which is the most potent and prevalent form of estrogen during a woman's reproductive years. I will be mostly focusing on estradiol today. The other two types are estrone and estriol, with estrone being the weaker form of estrogen that is prominent after menopause, and estriol, which is the weakest form of estrogen. Estradiol has a molar mass of 272.4 grams per mole. It is nonpolar and hydrophobic, and it is lipid soluble. Here are some of the main functions of estrogen. In women specifically, estrogen helps regulate the menstrual cycle and promotes development of female reproductive organs, helps support breast development and changes during puberty, maintains bone density and helps prevent bone loss, and also affects mood, skin health, and cholesterol levels. While in men, it helps regulate bone health, libido, and sperm production. Estrogen plays a vital role in reproductive health, bone maintenance, and metabolic regulation in both sexes. Estrogen is mainly produced in the ovaries, placenta, adipose tissue, liver, and adrenal glands in women, and in men in the testes, adipose tissue, and in the brain. Estrogen is mainly metabolized in the liver, where it's broken down into inactive or less active forms. These forms are then sent to the intestines and kidneys for elimination through stool or urine. A group of gut bacteria called the estrobolome can influence this process by reactivating some estrogen, allowing it to be reabsorbed and recycled into the bloodstream. If the liver or gut isn't functioning well, estrogen may not be cleared properly, which can contribute to hormone imbalances like estrogen dominance. Estrogen dominance can contribute to several health problems when the body has too much estrogen relative to progesterone. It's linked to conditions like heavy or irregular menstrual bleeding, which can lead to anemia if untreated. Estrogen dominance also increases the risk of developing uterine fibroids, which are non-cancerous growths in the uterus that can cause pain and bleeding. Another concern is endometriosis, which is a painful condition where tissue similar to the uterine lining grows outside of the uterus. Over time, prolonged estrogen dominance may raise the risk of certain hormone-related cancers, such as breast and uterine cancers. Estrogen deficiency occurs when the body produces too little estrogen, which commonly happens during menopause or after surgical removal of the ovaries. Low estrogen levels can cause symptoms like hot flashes, night sweats, vaginal dryness, and mood swings. Estrogen deficiency can have very serious long-term effects on the body. It can lead to decreased bone density, increasing the risk of osteoporosis and fractures, and it also helps maintain healthy cholesterol levels, so deficiency may contribute to a higher risk of heart disease. Cognitive changes, such as memory problems and difficulty concentrating, are also linked to reduced estrogen. Let's talk about the diagnosis and treatment of both estrogen deficiency or dominance. Estrogen dominance is typically diagnosed based on a combination of symptoms and hormone testing. Doctors will often start by reviewing symptoms like irregular periods, mood changes, or breast tenderness. Then, blood tests can be ordered to measure levels of estrogen and progesterone to check their balance. Sometimes saliva or urine hormone tests are used as well. There are two ways we can clinically treat estrogen dominance, and this includes aromatase inhibitors and GnRH agonists. Aromatase inhibitors block the enzyme aromatase, which converts testosterone into estrogen, and this helps to lower estrogen production, and this medication is often used in hormone-sensitive conditions like breast cancer or ovarian cancer. GnRH agonists work by suppressing signals from the brain that tell the ovaries to produce estrogen, and this effectively reduces estrogen to very low levels. This medication is typically used for short-term conditions like endometriosis or fibroids. Estrogen deficiency is diagnosed by evaluating symptoms such as hot flashes, vaginal dryness, or irregular periods, and confirming low estrogen levels through blood tests, primarily measuring estradiol. Some of the treatment options for estrogen deficiency include diet changes hormone replacement therapy, or birth control pills. But while hormone replacement therapy can be a very effective way in treating estrogen deficiency, it's not suitable for everyone. HRT may increase the risk of certain health issues in some individuals, such as blood clots, stroke, breast cancer, or heart disease, especially when used long-term or used later in life.